There are a lot of different treatments for tendon pain outside of surgery, and so that's my real focus and specialty. So I provide care, musculoskeletal care or sports medicine for all non-operative patients. Tendons are structures that connect muscles to bone, and it's a common site of pain in the area. So what we know about tendons is that they don't have good blood supply. And so when the body tries to heal the tendon over time with continuous injury, it puts down additional tendon. Then that tendon structure is thick and it's stiff. It doesn't do what it should do as easily. So then everyday life activities bother it because it's not as stretchy as it should be. And with that extra thickened tendon, we get extra nerve tissue. And so then it's very painful with doing just grabbing a cup of coffee. So we need to do something to help stimulate that tendon to heal, to help bring blood flow to an area that doesn't have good blood flow, help to break up that thickening and that abnormal tendon tissue, and then to help to stimulate the body to increase the cells that are in that area and heal. For tendon issue, outside of the standard activity modification and exercise or physical therapy, there are some new and innovative treatments that we can provide. One way is a needling procedure that I do. It's called a tenotomy. So I use an ultrasound to look at the tendon and to identify the area in the tendon that is abnormal. And an ultrasound is a special device that lets me look real time in the office at the structures underneath the skin. Once I find the area that is the most abnormal, then I simply just pass a needle through that area to mechanically break up the thickening, break up that scar tissue, break up that abnormal nerve tissue, and increase blood flow to the area. That's one treatment option. Another new option that we provide are platelet-rich plasma injections. So that's a blood-based injection. We take your blood from your arm in the office, and we spin it down in a specialized machine that separates out all the blood products. And then what we're left with is your body's own natural plasma. It's rich in growth factors, healing factors, and platelets. And platelets are our body's signaling factors. And then we inject that back into the area of damage in the tendon. That helps to stimulate the tendon to heal. And then outside of needling interventions, there is a new treatment that we also do, and that's called shockwave therapy. So it's an external device that we place up to the tendon, and inside the device there's a metal component that oscillates or moves quickly inside the chamber, and that produces sound waves. And the sound waves go into the tendon and the tissue and help to increase blood flow, help to stimulate cell turnover, help to break up that abnormal nerve tissue, abnormal thickening, and that helps the tendon to heal. And so over time, after a series of treatments, that you're better after each treatment. And all of these treatments are performed in the office, same day, type of procedure. We walk you through all of the protocols afterwards, and then we get you into physical therapy to help you strengthen the muscles around the tendon so that this problem doesn't come back and you're healed fully. Tendon pain can be a problem that only lasts a few days to months and years. And so I say that any pain that you have in your body that is affecting your quality of life and stopping you from doing what you need to do or want to do in terms of work, childcare, recreational activities, then it's time to see a doctor. If it's affecting your sleep as well, then that's a really important sign that you should see someone about it and do something about it.